So, why do you need two biopsies that are benign before we can do a radiofrequency ablation of a thyroid nodule? Well, it's just being very, very careful. And the reason is that we would not ever want to do a radiofrequency ablation on a malignant, large malignant lesion. There are malignant lesions, cancers, thyroid nodules that we do radiofrequency ablation. Those are microscopic, less than 1 centimeter. And most of the time, we're doing radiofrequency ablations on large nodules that are causing significant symptoms. And so we want to be sure that these nodules are benign. And the way we do that is by having one biopsy. There's always a false negative possibility with a biopsies. And also there's the possibility of the fact that there's a large nodule, that there may be an area in the nodule that has some cancerous cells that we didn't hit at the first time when we did the biopsy. So this is all to prevent the possibility of doing a radiofrequency ablation on a nodule which is potentially malignant. We just do two, and we feel comfortable, and the guidelines are clear that we can use two negative biopsies as a good evidence that we can then proceed with a radiofrequency ablation of a benign nodule. So why is it that when we do a biopsy and we get a negative result that means it's benign, there's still a chance that we could have a thyroid cancer? Well, any test has a false negative rate, and in a thyroid biopsy, it's around 2%. But if you do two biopsies in a patient who has a thyroid nodule, there's been studies that have shown that this is essentially almost 100% chance that this is a benign nodule. In medicine, we rarely talk in all or nothing terms. There's too much variability in the human body. So we still understand that there are possibilities, but the likelihood is so low that we can feel confident about moving forward and doing a radiofrequency ablation, for instance, in a nodule that has had two biopsies and is benign. When we're considering a thyroid fine needle aspiration biopsy, does needle track seeding matter? So first, let me talk about what needle track seeding is. Basically, in some areas of the body, there is a concern that if you do a biopsy, you might spread a potential cancer into some other part of the body. That does not happen in thyroid disease. It does not happen in thyroid nodules. It's not a part of that process. So when you are getting a biopsy for a thyroid nodule, there's no chance that there'll be seeding of a potential malignancy. And the fact of the matter is that the likelihood of a malignancy is low to begin with. So we're doing biopsies on patients with a percentage of a malignancy, which is probably less than 5%. So I think the important point here is that don't get concerned about needle track seeding and not have a biopsy, because the biopsy is important to make it a good decision as to what the next steps are in your treatment, and we have to have that information in order to do that. So please get your biopsy and don't worry about needle track seeding.